Hello everyone, my name is Adrien Barton. I'm a researcher at CNRS in France and at Sherbrooke University in Canada. And today I'm going to present you joint work with Fumiaki Toyoshima and Jean-Francois Ethier about clinical documents and their parts. First, a few considerations about what we call the mereology of documents. Let's start by noting that there is a huge variety of clinical documents from which we could extract very useful information, from drug prescriptions to laboratory test prescription and reporting documents and questionnaires, etc. And to account for this kind of document, we have in the OBO foundry an ontology, which is the information artifact ontology based on BFO. And it introduces a class, namely information content entity, ICE, where an ICE is about some portion of reality. So there is this connection of aboutness between informational entities and the external world. Now the question is, how can we represent ontologically the mereological structure of a document? This is important for several reasons, one of them being that the semantics of a document is constrained very strongly by the semantics of its parts. So it is important to represent those parts and those parts with relations in the first step when you're interested in the aboutness. As you know, mereology has been extensively studied in ontology. And a classical system called the classical extensional mereology considers part rule as a partial ordering relation that satisfies some additional axioms, such as weak or strong supplementation. But when you deal with informational entities, you cannot take this system for reasons I'm going to explain. And therefore, we have developed first a theory of mereology of information content entities based on the work of Bennett. And this first work has been accepted to FOIS 2020. And then we created a second work for ICBO, which I'm going to present to you. But first, let's say a few words about the general framework. So in our framework, we have two kinds of informational entities. We have fillers and slots. So imagine you have a document, a clinical document with different lines representing, to simplify, different diagnoses. So the first one, you have John Doe flu to represent that John Doe had the flu, and the second one, John Doe asthma, to represent that he had asthma. And the first diagnosis, here there is a slot which has itself two slots, one for the patient name and one for the condition name. And then you fill the first slot with John Doe, you fill the second slot with flu, and by doing so, you fill the whole slot diagnosis 1 with John Doe flu. Same for diagnosis 2. So here, what you notice is that you can have the same filler, namely John Doe, that fills two different slots in the same document. Therefore, a document can have a part twice or more over. And this is what differentiates it from classical extensional mereology. In our theory, we also accept that slots can be unfilled to describe templates. Here you see none of the slots are filled, or partially filled documents. Now, what we address in this ICBO paper are two questions. First, how to account that some slots can be inadequately filled. And second, how to account for the layer structure of some documents. So let's continue with this question of adequate versus generalized filling. First, let's notice that some documents can be incorrectly filled. And we need to be able to represent any document, even when they deviate from the norms. So we introduce two relations of filling. The first one is adequate filling, for filling a slot in a normatively correct way. And the second one is generalized filling, for filling a slot in any kind of way, normatively correct or not. And the question is, what are those norms? Well, we can distinguish at least three kinds of filling inadequacies that we're going to illustrate with this example. The same one as before, but you see here that the slot patient 0 has two slots, one for the first name and one for the last name. The three kinds of inadequacies are structural inadequacy, semantic inadequacy, and descriptive inadequacy. Structural inadequacy is simply the idea that some slots are not filled. This is what you see here, where the slot last name has not been filled. And this is probably the easiest kind of inadequacy to control with electronic document. Just check, that every field has been filled. The second kind of inadequacy is semantic. So imagine that we fill the diagnosis 0 slot with the words John Doe 70 kilograms. Well, here, 70 kilograms that fill condition 0, it does not refer to a medical condition. So it's not the right kind of thing. So that's a problem of aboutness. That's an inadequacy which is semantic. The third kind of inadequacy is descriptive. Imagine that we write that John Doe had flu, but actually John Doe never had the flu. Interestingly, from an ontological point of view, this kind of inadequacy can be seen as a kind of semantic inadequacy, because the filler of diagnosis 0 here, it just does not refer to a state of affairs that occurred, so it does not refer to the right kind of things. But epistemically, it is very different from the classical semantic inadequacies that I presented earlier, because we can have a dictionary to know what are all, for example, medical conditions, but we cannot have a dictionary for all the state of affairs that occur, right? So that's why we dissociate descriptive inadequacy from semantic inadequacy. So we want to make this distinction between adequate filling and generalized filling. Adequate filling is what has been formalized in the FOIS 2020 paper, and generalized filling has been formalized in the ICBO 2020 paper. So here I refer to you to the paper for the formalization. Just briefly, we can, thanks to this relation, express some axioms. Axiom to express, for example, structural adequacy, like patient slot can be adequately filled only by things that have as part one first name and one last name. And some axioms to express semantic adequacy, for example, patient slot is adequately filled only by patient name, and condition slot is adequately filled only by clinical condition name. Let's now finish with some considerations about direct slots and direct parts. So in this example, we have diagnosis 0, which has a slot patient 0, and patient 0, which has a slot first name 0. And by some axioms of inheritance or transitivity that we accepted in the theory, diagnosis 0 also has a slot first name 0. But intuitively, it is not a direct slot. So that's what we have been representing in the paper, this notion, this relation of having a direct slot. And for the axioms, the general axioms that it satisfies, I refer to you to the paper. And once we have this relation, we can express specific axiom depending on the context, such as stating that a diagnosis document has as direct slot exactly one patient slot and one condition slot, but nothing else. It can have other slots, but those are not direct. And we can also introduce the relation of having a direct proper part, which is just having a direct slot filled by this proper part. Thanks to this theory, we can now represent, for example, the layered slot structure of a drug prescription, as we have been representing it in PDRO, the prescription of drugs ontology. But now we have the tool to re-express it in a more systematic way using slots and fillers, with slots for various elements such as the drug product, the condition to continue the distribution, etc. As a conclusion, we can now represent the same filler filling various slots, either in the same documents or in different documents. We can represent templates or partially filled documents. We can represent adequately and inadequately filled slots, as well as a layered structure of a document. That's it. Thank you very much for your attention.